Hey everybody, Brian Lynn of ClickSF here to give you a quick tutorial on the RIME rubric and the reason why we use it. RIME stands for Reporter, Interpreter, Manager, and Educator. And RIME is the assessment tool that we are primarily going to be using here at Kaiser Permanente Longitudinal Integrated Clerkship in San Francisco. Why do we RIME? Well, RIME provides a simple, common language to track a learner's professional development. If you don't care to bother with different esoteric systems for understanding how to grade students like core competencies and EPAs, well, RIME maps to these other common assessment rubrics without you having to worry so much about the jargon, but rather just focus on your learner's professional development. Subsequent to that, RIME is used in over 40% of US medical schools. So what does RIME entail? Step by step. R is for reporter. A reporter is the first phase. This is where we all typically begin in Foundations 2 or the beginning of our clinical year of medical school. A reporter relies on accurate information gathering. A reporter is able to take pieces and then break them down and restructure them into a cohesive and understandable format, like your history and physical examination. An accurate reporter will have all of the information, and they're going to have all the information correctly. The next phase in development is the interpreter phase. An interpreter is able to contextualize and prioritize a patient's problems. An interpreter will naturally begin to shorten the presentation. They'll give you an HPI that's much easier to understand. It's going to be much easier for you as a teacher to find the relevant pieces of information. So even prior to getting to their assessment and plan and having them verbalize their thinking, you'll be able to understand that they're interpreting in the way they present a case. M stands for manager. The manager phase is where the learner begins to take ownership of their patient. And you'll most likely see evidence of this in the constructs they create in their assessment and plan. A manager is able to find solutions to problems. A manager is able to take the information they have and come up with not just short-term plans, but also long-term plans that think about the big picture for their patient. A manager's skills will, of course, gain sophistication with time. The final stage in the RIME rubric is the educator phase. An educator has the ability to not just take the information and come up with an assessment and plan, but also to teach it back. This includes teaching to peers, such as newer learners, other students who come after them, and of course, teaching their own patients. If you observe the way your student interacts with your patient, you may see evidence of how they're able to educate. And beyond this, an educator gains the ability to be nuanced and explain the same concepts at different levels of health literacy. So they can take the diagnosis of pneumonia and explain it in a complex fashion to somebody with a higher health literacy and explain it in more simple terms with somebody with a lower health literacy. An educator is also an educator of themselves. They're able to identify their own knowledge gaps and what they need to know in order to move forward. So being an educator doesn't mean you have to know everything. A couple corollaries that you should know for RIME. Firstly, RIME is not meant to be a fixed progression throughout a single year. In fact, most experts would say that RIME takes about 2 years from start to finish, sometimes even longer, well into residency. RIME does not necessarily correlate with grading. So just because you have a student who's in the reporter phase doesn't mean they're failing. And just because you have a student who's in the educator phase doesn't mean they're doing a great job. This is just one of the ways in which we are able to gauge our students' development and help them to get to the next stage. It's important to know that RIME skills are always in refinement for all of us. A couple of tips on how to RIME. Well, every time you take a presentation from your student after they've seen a patient, think about where you think that would fall into the RIME rubric. And you can use that to designate your RIME adjective when describing your student. It's important to have multiple brief observations of clinical skills in action. And this includes everything from observing a history to an exam to a written note. It doesn't mean you have to stand over your student's shoulder the entire time they're performing their entire history and exam, but coming into the room, watching for about 2 to 3 minutes, gathering some observations from time to time can help you to understand your student's progression much better. And when you come up with your RIME adjective for your student, you want to think consistency. Are they reporting consistently? Are they interpreting consistently? Are they able to show skills of management consistently? So you guys ready? Because RIME time is coming up. Soon you'll receive your written RIME evaluation on MedHub, and we'd like you to think about where your student falls in the RIME rubric and use that as a way to frame the way you talk about your student, because soon we'll all sit around a table for our RIME roundtable where we will discuss your student's progression, and it will be helpful if you come with your RIME adjective in mind to help frame the discussion. If you want some more references about how RIME works, you can follow these articles, the original article that describes RIME as well as its use in an LIC. I've also curated a series of videos on YouTube, which you will find right here, that you can also watch to learn more about how RIME works. I wanted to thank you all for being a part of Click SF. It's been a wild ride so far, and I know we have a lot of great times ahead, and I'm looking forward to every step.